Next panel will be Christopher Russo, Robbie Ali, Linda Fowler, Nancy Cardona, Cordelia Ryan, Johanna Close. They will be followed by Amy Maddox, Stacy Gridry, Chelsea Barlow, Kimberly Gilby, Carlos Arena, and Joanne America. Christopher Russo.
Howdy, my name is Chris Russo, and I am represented by Senator Schwardner, and I am testifying in favor of SB 1. Thank you, Chairman Nelson, for holding this committee meeting and for giving us the opportunity to speak. On a bill that addresses as many specific policy issues as this one, I think it's often difficult to parse through the minutiae and the individual policies of these bills and get to the truth of the matter. And at the very foundation of it, in any society, the right to life and the dignity of the human person are the bedrock upon which other fundamental freedoms stand. And when these erode away for the most vulnerable within a society, generally we see an erosion of freedoms follow for the rest of us. There are a couple of specific issues brought up, and I had a prepared testimony, but that's already been brought up. So what I would like to point out are a couple of inconsistencies that I see in the arguments that are brought up. Now, we're talking about if these restrictions and additional measures are put into place, the claim is made that these clinics that provide other health services would have to close. And I think that unless we go as far as to make the fundamental assumption that a significant portion of these clinics' income, it comes from abortion, which is something that I think that the pro-choice side is very hesitant to state, then we can't automatically make the assumption that all of these other services that are afforded to women would then close. And I think that we can parse through these arguments in such a way that we can find a solution that both reduces abortion and still allows us to have access to vital health care and, as has been shown by the pro-life movement, care for women that are in these situations after they choose to carry their pregnancy to term. Thank you.
Thank you, Ms. Osley.
Thank you. My name is Robbie Ali, and I'm a constituent of Kirk Watson. And I, too, want to thank all of you for your incredible patience in allowing us to testify. Growing up in Lubbock, Texas, and meeting my husband at Asbury Methodist Youth Fellowship at the young age of 14 gave me a fairly secure but limited perspective of life. However, over the years, as my hair turned from blonde to silver, I learned through my journey with Tom, my husband of 50 years, as well as our 4 grown children and our 10 grandchildren, that complex issues are not solved with simple solutions, which too often trivialize the human dilemmas in our journeys. Our family's faith tradition, the United Methodist Church, also recognizes these human dilemmas, as well as the complexity of the issue of abortion, which is reflected in our Methodist Church's social principles. And I will quote from those social principles. The beginning of life and the ending of life are the God-given boundaries of human existence. Our belief in the sanctity of unborn human life makes us reluctant to approve abortion. But we are equally bound to respect the sacredness of the life and well-being of the mother, for whom devastating damage may result from unacceptable pregnancies. In continuity with past Christian teaching, we recognize tragic conflicts of life with life that may justify abortion, and in such cases we support the legal option of abortion. We commit our church to continue to provide nurturing ministries to those who terminate a pregnancy. I also have learned that behind every choice is a story. Even though some of those stories can be heart-wrenching, they also can be stories of life-affirming decisions made within the context of a woman's faith. I believe any definition of a human life that neglects the moral reality required to nurture and sustain life after birth is very dangerous. I also strongly contend that the woman, with the advice of her doctor and support of her family and family tradition, is the best person to ultimately make the decision to terminate a pregnancy, not her government and not elected officials. Thank you.
Ms. Fowler, Dr. Fowler.
Hello, I'm Dr. Linda Flower. I'm chairman of the Texas Physicians Resource Council, and I want to thank Senator Nelson and the committee for sitting through all of this. I represent about 1,500 doctors around Texas, and I'm testifying in favor of SB 1. Senator Patrick represents me. I live in Tomball, Texas. I'm a family doctor, and I practiced and taught obstetrics for nearly 20 years. And I now work in a minimal-fee Christian community clinic where we would care for the young lady who was up here earlier, Robbie Ali. I'm also on the Board of Trustees for the Christian Medical and Dental Association, a national group of over 15,000 doctors and dentists that support the pro-life principles in this legislation. Regarding ASCs, my question would simply be to the clinics that are in existence. They've had many, many years, 40 years since Roe versus Wade, to upgrade, and I don't understand why it is so hard to come up to the ASC standards. Regarding medical abortions, to conform to FDA standards, including the provision for follow-up care, will greatly improve safety for women. I've cared for women in the emergency room after abortions who could not give me the name of the clinic, the procedure type, nor the name of the abortionist. Also had no mechanism to report these complications, and I'm not aware that that's available now, and that maybe that could be added. The provisions in the bill identifying the doctor, facility, supplying emergency numbers to their patients is much needed. As far as I know, abortuaries are not required to report statistics, which is why we cannot report complication rates in the U.S. and have to go to Finland for reliable statistics. We support efforts to make sure those performing abortions are competent and can deliver medical care available if make it available if a complication should occur. Finally, in regard to fetal pain, Dr. Jean Wright, an anesthesiologist and member of CMDA, testified before Congress over 10 years ago that a 20-week fetus can feel pain. Thank you.
Thank you. Robbie, no, wrong direction. Nancy Cardona.
Thank you. My name is Nancy Cardenas. My permanent address is in Palmview, Texas, which is 20 minutes away from McAllen, Texas. So my senator would be Juan Chuy Hinojosa. My name is Nancy Cardenas, and I represent myself, and I oppose SB 1. I oppose SB 1 because it undermines women in Texas. Furthermore, legislation drenched in religious dogma has no place in this debate. When it comes to the decisions I am more than capable of making for my own body. The absence of women from the Rio Grande Valley should alarm you. And while I will not pretend to be the voice of all women from South Texas, I am most certainly one of them. I am a first-generation Mexican-American woman who was among the first to attend college in her family. I was blessed with opportunities that many do not have. And this is where the heart of your bill lies. It disenfranchises the less privileged by imposing a hard burden on women who will have no other choice but to drive hundreds of miles away for a safe abortion. This isn't chump change to us. And while I am happy that the maker of this bill finds himself in such a privileged position, I am afraid that I cannot say the same for the rest of the women in Texas, especially women from the RGV and El Paso. We all have hopes, ambitions, dreams, and stories, and I can assure you that abortion is never a part of these. My body should not be a token on your political battleground. Texas is fourth in teen pregnancy rates. Hidalgo County ranks among the highest for teen pregnancy rates in the state of Texas. Hidalgo and Cameron County account for the poorest counties in the United States. How exactly do you find it sensible to ban the only resource these women have to affordable health exams and safe abortions? I stand before you and humbly ask you to include the voices of South Texas women. I humbly ask you to take the time to review the repercussions of SB 1 and the disastrous effects it will have on women from rural areas. We are voters. We are women. We have a voice, and we are responsible enough to make our own decisions. We do not need your guidance. We can take it from here. Thank you, and please oppose SB 1.
Cordelia Ryan.
Thank you, Madam First of all, I want to say God bless you, each one of you, for your public service to us Texans. I'm greatly honored. My name is Cordelia Ryan, and I support SB1. In my humble opinion, it stands for the acronym SAVE. Can y'all hear me okay? My name is Cordelia Wright. I support SB1. In my humble opinion, it stands for the acronym SAVE Babies First. I reside in San Antonio and an honored constituent from Dr. Donna Campbell's district. Dr. Donna Campbell, your constituents, thank you for your standing up for truth in life. Thank you, Senator Zaffarini, for your position on life. I voted for you when you represented me when I resided in Laredo. Gracias y Dios lo bendiga. I'm here today representing a precious lady by the name of Samantha Cobb, who fainted in the state capitol halls last Tuesday and wanted to share her testimony but couldn't because she was removed unknowing and sent to the ER. Her story, and like her, here's her story, and like her, I'm also representing the unborn babies who are thinking they were safe in the halls of their mother's womb when they were removed unknowing. My name is Samantha Cobb. I'm a cardiovascular technician, and my job is to help save lives. But at the age of 16, I took the life of my unborn baby. Because of the act of murder and selfishness, my boyfriend abused me and threatened me, and he put me through this act into a prison of horrible emotional bondage until the age of 42. If you think that abortion doesn't harm anyone, I'm here to tell you that it does. It can, and it will destroy your life, both mentally and physically. I'm the physical evidence, and sterility and other ways to see, but psychologically side is the hardest to see. I have lost all respect for myself, my self-esteem, and self-worth. It has haunted me my entire life. I let men abuse me sexually, mentally all my life, but through the Godly Reconciliation Ministry at Cornerstone Church in San Antonio, God's grace and the blood of Jesus Christ, I am set free. That is her story. It can also be yours. Now the fact is abortion has murder, and the silenced majority of approximately 55 million now grow up to be mothers. If you could hear the millions of those silenced voices, they would say thank you for fighting.
Thank you for being here to testify. Is she doing all right?
Yes, thank you very much. She says thank you. Allow her to
thank you. What's who? Johanna Close.
You heard me.
No.
Okay.
I'm reading
hello, my name is Johanna Close. I am a born and raised Texan, and I'm living in Austin, Texas. Senator Kirk Watson is my representative. I am opposed to SB 1. I believe that Senate Bill 1 will in no way increase the health and safety of Texas women. The country already knows the pain and heartache that comes with not having available and safe abortion clinics. It makes women turn to methods and means that are detrimental to their physical and emotional health, such as backroom abortions and old wives' tales like Coca-Cola and Alka-Seltzer. The founding members of the United States left their home countries to be able to lead a life of their own choosing, and to have religious persecution become something of the past and not of the future. This law directly goes against these founding ethics our country was built upon by letting religion, not science, dictate the laws. I also wanted to include one thing in my testimony. I've heard many people talking about the rates in different European countries. One thing I want to point out is most European countries have national health care, they have free birth control, and comprehensive sex education. Texas is #1 in multiple teen pregnancies. This is not taking care of our citizens and our women. I strongly encourage you to make the decision that will best support the health, welfare, and choice all women deserve in Texas. Please vote against SB 1. Thank you so much.
Thank you. Thank you to this panel.